Hello and welcome to my thing. So currently I am the surgeon, and this is treating. They don't mind the sister in the bracket. So we're gonna teach doctors how. We're gonna teach people in the hospital how to treat tumors. So all I gotta do is just listen and follow the instructions. But some of the instructions are very confusing, but I will show you later. So, actually, we had another attempt at doing this, but my sister called me for lunch. So, so currently I am reporting the vital signs, and this is my other iPad, and then I'm grabbing a patient gun from the supply room. The supply room is where you spawn as a doctor and a nurse. But currently, for the surgeons, they spawn in the surgery area. Now, this is where most people get very confused. Insert bed by pressing the button in the control room. And now, well, people say, where is the control room? It's in the MRI, and the MRI is it's near this the emergency code things, and it's near room 4. So currently, I'm the surgeon. You put it here, and then you see the iPad right over here. Then that means that okay, so we're about to start. So I pressed insert bed. You can see it in the control room. So now I start the MRI, and then well, this is very very short. And then now the the surgeon is gonna take the patient or the player in, into a wheelchair and bring you back to the ER or any other room. Sorry, Lola, I kind of got confused here. So after you bring me back to the control room, back to the bed, then you will attach a safely sedated patient to the door. So the IV is like at my left of the bed controls. Currently, I'm reviewing the symptoms, and I just got a glitch in the computer, and so you just wait for a bit, and so now you get a blood sample, and the blood sample is again, and it's near the reception, and it's beside the urine samples. So currently I'm getting the blood samples. No, the gloves. The gloves are right near the medic office, and that's beside one of the rooms. And it also can be found in one of the rooms. So now I am going to the patient, my alt, and I'll draw the blood. And then after that, you doctors, since this is as if you're not doing this in a public server, then you after this, then you then you go to the lab, which is on the second floor. Right after you see the second floor, that's the lab, and there's the pharmacy in the lab. After that, you dispose of the gloves, and you wash hands in the sink. You wash hands in the sink in the lab, and for me, I'm just currently I found the sample. I found my old sample, and I'm putting it in the blood test. Oh, so next you print the surgery consent form from the printer, and the nearest printer you can see to the AR is near the supply room, and then and then and then after you print, you wait for a few seconds, and then after that you give the consent form to the patient, and then which the patient will just stay there if it's a player, but if it's an NPC, the NPC will be brought to pre-op. But if you want to give the player to pre-op, then you use a wheelchair and bring him to pre-op. Through the printer, there's a brown filling box you can see. You put the brown filling box and you put the consent form in the brown filling box, and your patient will be ready for surgery. Actually, this thing is optional. So if you wanna know how to actually do this, then if you know how to make people have surgery, then I will show you this on how to make your players or the NPCs get the surgery. Once you start to scrub in, then you go to the surgery rooms. Then you scrub in, and scrubbing in is where so actually you so it's near the surgery rooms. You still put it's after that you get a sterile towel, cleaning it. You put your gloves, you put your mask, you put your surgical down. After that, you go to you place a clean sheet on the surgical bed, and now an NPC is gonna take you to the surgery area. And then, so currently this is surgery room 1, and this is the best part. So now, surgical nurse is gonna set up the tools and attach the saline IV, and then put an oxygen mask and turn on the surgical lights. After she puts it on, you will greet the patient, and after that, you get a sedative from the closet. Then you push it, and then you wait. You don't try to retry it. You wait until it disappears, and then there's a next instruction. After that, you grab a saline flush, and then you do the same thing with the sedative. After that, the surgical nurse will intubate the patient. Then, you put a betadine bowl on the table, you fill, and they get a betadine bottle, then a sponge forceps. You soak the sponge before the betadine. Then, you sanitize the patient's skin. And now, you make an incision on the skin. And you use the cautery pen, you cauterize 2 blood spots. Then use the cautery pen to open the fat layer. Then you cauterize 3 blood spots. Then use the cautery pen to open the muscle layer, and then you will see the tumor. But first you have to cauterize 2 blood spots. Then the surgical nurse will remove the retractors. Then you clamp the vessel to the tumor. Then you get the scissors and use the cautery pen around the tumor to seal it. After that, you drag the tumor to the special container, and then first you check for bleeding, and now you cover the skin. After that, your patient will be taken to post-operations. Then, after that, there's a specimen container near the betadine bowl. After that, so let's just wait for the patient so you can understand what I'm saying. Okay, so now you throw away your gloves and mask, Then you get the specimen tail near the betadine bowl, and then there's a nearby tube system near you. And the tube system is near the post-operations room. And and after that, you go to the computer to log the surgery, and then you're done. You're done. You're done. Good job. Anyways, it was nice knowing you all. So, sorry, just don't mind that. So now, your patient will get an emergency, and I don't really know why. That's so. It's I hope this is good in the future.